Mindfulness is a self-regulation tool that has been used for thousands of years. It is an awareness of the present moment with acceptance. Self-compassion is defined as the wish for oneself to be free from suffering, and it relies heavily on the idea of mindfulness. Self-compassion has an extraordinary impact upon mood and well-being, and it can be a powerful take-home tool that psychotherapists are beginning to use in sessions with their patients. In this clip, Dr. Ruth Buczynski interviews Dr. Christopher Germer about the relationship between mindfulness, self-compassion, suffering, and healing.
I'm Dr. Ruth Buczynski. I'm a licensed psychologist in Connecticut and also the president of the National Institute for the Clinical Application of Behavioral Medicine. I'd like to welcome our guest today. It's Dr. Christopher Germer. He's a clinical psychologist in private practice. He specializes in mindfulness and acceptance-based psychotherapy. He's a clinical instructor in psychology at Harvard Medical School, and he's the author of 2 books. The first kind of hit the scenes a couple of years ago. It's now the seminal work in this topic. It's Mindfulness and Psychotherapy. He co-edited this with Drs. Ron Siegel and Paul Fulton. And his most recent book is The Mindful Path to Self-Compassion, Freeing Yourself from Destructive Thoughts and Emotions.
Mindfulness is the foundation of self-compassion because compassion is the wish for oneself or someone else to be free from suffering. It presupposes suffering. Now, but if we don't know we're suffering, we can't develop compassion. We need to have some traction with suffering. We actually need to know it. So mindfulness, a really good definition of mindfulness, which I like from Guy Armstrong, is knowing what you're experiencing while you're experiencing it. But it's not just knowing intellectually, it's actually feeling it. So in order to develop, usually we're just too wrapped up in our thoughts to even feel the pain that we have. We're like ruminating about it. It's kind of like James Joyce said in the Dubliners, Mr. Duffy lived a short distance from his body. Usually that's us. You know, we can't say ouch, or this hurts, or this is disturbing. We're not actually in touch. So mindfulness means we know we're in pain, moment to moment. And then there's a kind of, when mindfulness moves into the therapy domain, then their acceptance gets brought into it. Because if we feel disgust or aversion toward what's ailing us, you know, when we close our eyes to it, we really can't know what's going on. So what we've found is that the greater the intensity of suffering we feel, the more acceptance we need to be mindful. But acceptance doesn't mean resignation. It doesn't mean we just accept stuff. In fact, Stephen Hayes defines acceptance as active, non-judgmental embracing of experience in the here and now. And so what I've found is that, for example, women in abusive relationships, when they accept their pain, when they can say, this hurts, this really, really hurts, and they stop making excuses for the person who's harming them, then they actually find a way out of their relationship. So acceptance is more often, true moment-to-moment acceptance is more often a prelude to effective action rather than a kind of
I see. So
resignation.
Let's get into this, Chris, further. How exactly does that work? How does mindfulness and acceptance actually promote emotional well-being?
In the mindfulness world, there's a certain amount of pain in life, and that's inevitable. And then we instinctively resist it. You know, mentally and physically we pull away from pain, and we also pull away from emotional pain instinctively. And this instinctive process, from a mindfulness point of view, is what causes suffering. So the formula is pain times resistance equals suffering. If resistance goes to 0, then suffering goes to 0. And the good news is that most of the pain that we have in life, and not most of the discomfort we have in life, is actually not pain. It's suffering. It's the way we ruminate about stuff and layer problems on ourselves by fighting with the way things are when they don't feel good. So pain is inevitable and suffering is optional. Now, all therapists know this, you know, and anybody in the healthcare world knows this. For example, when we fight sleeplessness, we create insomnia. If we fight anxiety, we can develop OCD or panic disorder. If we fight grief, we can develop depression. When we fight back pain, when we catastrophize about it and we tighten our bodies, we develop chronic pain syndrome. So mindfulness and acceptance and compassion, they're the opposite of resistance. We're actually not trying to change what we're feeling in the present moment. We're establishing a new relationship to it, a more open, spacious kind of allowing of pain to flow in and out of our lives. That's the mechanism of mindfulness and compassion.